The Registered Professional Counselor certification represents a commitment to professionalism and competency in the counseling field. By meeting educational and professional standards, RPCs are equipped to provide effective mental health services to clients. Understanding what the RPC certification entails and its significance will be helpful as you prepare for the CPC exam, as it emphasizes the importance of formal qualifications in promoting positive counseling outcomes. Examination boards. National Board for Certified Counselors. Let's discuss the National Board for Certified Counselors. This organization plays a significant role in the counseling field by setting standards for counselors and providing certification opportunities. Here's a breakdown of key concepts, important details, and examples to help you understand this topic as you prepare for the CPC exam. Key concepts 1. What is the NBCC? The National Board for Certified Counselors is a nonprofit organization based in the United States that provides national certification for counselors. It was founded in 1982 to improve the quality of counseling services and ensure that counselors meet established professional standards. 2. Purpose of the NBCC. The main purpose of the NBCC is to promote effective and ethical counseling practices through certification. It helps protect the public by ensuring that counselors possess the necessary skills and knowledge to provide professional services. Important details 1. Certifications offered. The NBCC offers several important certifications, including National Certified Counselor, a foundational certification that shows a counselor has met specific education and experience requirements. Certified Clinical Mental Health Counselor, a certification for counselors who specialize in mental health treatment, indicating advanced knowledge in the field. Master Addictions Counselor, a certification for counselors who focus on addiction issues. Each certification has specific eligibility requirements, including educational credentials, supervised experience, and passing a national examination. 2. Examinations. The NBCC administers several examinations to assess the knowledge and skills of counselors. For example, the National Counselor Examination and the National Clinical Mental Health Counseling Examination are used for various certifications. These exams ensure that counselors have the foundational knowledge needed to provide effective services to clients. 3. Continuing education. To maintain their certifications, counselors are required to complete continuing education courses. This ensures they stay updated on the latest research, techniques, and ethical practices in the counseling field. 4. Ethical standards. The NBCC has a code of ethics that certified counselors must follow. This code emphasizes the importance of professionalism, confidentiality, and respect for clients. Adhering to these ethical standards is crucial in building trust and providing quality care. Examples illustrating the NBCC 1. Career development. A counselor named Sarah decides to pursue her National Certified Counselor certification through the NBCC. After completing her master's degree and gaining the required clinical hours, she passes the NCE exam. This certification enhances her job prospects, as many counseling positions require or prefer candidates with the NCC credential. 2. Specialization. After working in general counseling for a few years, Jamie decides to specialize in addiction counseling. He applies to become a Master Addictions Counselor through the NBCC. By obtaining this certification, Jamie demonstrates his advanced skills in helping clients recover from substance use disorders, improving his credibility and job opportunities. 3. Adhering to ethical guidelines. As a certified counselor, Alex follows the ethical guidelines set by the NBCC. When a client discloses sensitive information, Alex ensures he maintains confidentiality, respecting the client's privacy and rights. This adherence to ethical standards strengthens the trust in their counseling relationship. Conclusion. The National Board for Certified Counselors is a crucial organization in the counseling field that sets standards for professional practice and offers valuable certifications for counselors. Its focus on promoting ethical and effective counseling helps protect clients and enhance the quality of mental health services. Understanding the role and functions of the NBCC is important as you prepare for the CPC exam, as it highlights the standards and certifications that support professional excellence in counseling. National Counselor Examination. Let's explore the National Counselor Examination. This exam is an essential part of the process for becoming a certified counselor in the United States. Here's a breakdown of key concepts, important details, and examples to help you understand this topic as you prepare for the CPC exam. Key concepts 1. What is the NCE? The National Counselor Examination is a standardized test created by the National Board for Certified Counselors. It is designed to assess the knowledge, skills, and abilities needed to be an effective counselor. 2. Purpose of the exam. The main purpose of the NCE is to ensure that individuals seeking certification as counselors have the necessary understanding of counseling theories, ethical practices, and effective therapeutic techniques. Passing this exam is a key step toward obtaining the National Certified Counselor credential. Important details. 1. Who takes the NCE? The NCE is typically taken by individuals who have completed a master's degree in counseling or a related field and are pursuing certification as a counselor. This includes recent graduates and those who have met the educational requirements. 2. Exam content. The NCE consists of 200 multiple-choice questions that cover a variety of topics relevant to counseling practice. These topics include human development, understanding how people grow and change throughout their lives, counseling theories and techniques, different approaches to helping clients, ethical and legal standards, guidelines for professional conduct and legal responsibilities as a counselor, assessment and testing, methods used to evaluate a client's needs and progress, group counseling, techniques for working with groups of clients. 3. Exam format and duration. The NCE is typically administered in a computer-based format and takes approximately 4 hours to complete. Test takers receive a score immediately after finishing the exam. 4. Scoring and passing. Each candidate must achieve a passing score to obtain their certification. The specific passing score may differ based on the guidelines established by the NBCC, but it is generally set to reflect a candidate's competence in counseling knowledge and skills. 5. Retaking the exam. If a candidate does not pass the NCE on their first attempt, they can retake the exam after a specific waiting period. This allows them time to review and study the areas where they may need improvement. Examples illustrating the NCE 1. Preparing for the exam. Jamie has just completed her master's degree in counseling and is ready to take the NCE. To prepare, she enrolls in a study course and uses practice exams to familiarize herself with the types of questions she will encounter. After thorough preparation, she feels confident and takes the exam. 2. Understanding content areas. While studying for the NCE, Michael realizes that he needs to focus on ethical standards in counseling. He reads about confidentiality, informed consent, and the counselor's responsibilities. This knowledge helps him answer questions related to ethical dilemmas on the exam. 3. Passing the NCE. After taking the NCE, Sarah receives her results and sees that she passed. With her successful exam completion, she is now eligible to apply for the National Certified Counselor credential, a significant achievement in her counseling career. Conclusion. The National Counselor Examination is an important assessment for aspiring counselors in the United States. It evaluates the knowledge and skills necessary for effective counseling practice. Understanding the format, content areas, and significance of the NCE is crucial for your preparation for the CPC exam, as it highlights the importance of certification in ensuring quality mental health services. By passing the NCE, counselors demonstrate their readiness to help clients effectively and ethically. Examination for professional practice in psychology. Let's explore the examination for professional practice in psychology. This exam is an important step for anyone wanting to become a licensed psychologist in the United States and Canada. Here's a breakdown of key concepts, important details, and examples to help you understand this topic as you prepare for the CPC exam. Key concepts. 1. What is the EPPP? The Examination for Professional Practice in Psychology is a standardized test designed to assess the knowledge and skills required to practice psychology effectively. It is administered by the Association of State and Provincial Psychology Boards. 2. Purpose of the exam. The main purpose of the EPPP is to ensure that individuals seeking licensure as psychologists have a necessary understanding of psychological theories, practices, and ethics. Passing this exam is typically required to become a licensed psychologist in most states and provinces. Important details. 1. Who takes the EPPP? The EPPP is taken by individuals who have completed a doctoral degree in psychology and have met other state-specific requirements, including supervised clinical experience. 2. Exam content. The EPPP consists of 225 multiple-choice questions, of which 175 are scored and 50 are unscored. The exam covers several key areas, including biological bases of behavior, understanding how the brain and body affect thoughts and behavior, cognitive affective bases of behavior, how thoughts, feelings, and emotions influence behavior. Developmental psychology, the study of how people change and grow throughout their lives. Social and cultural foundations, how society and culture impact behavior and mental health. Assessment and diagnosis, techniques used to evaluate psychological disorders and create treatment plans. Treatment planning and intervention, strategies for helping clients improve their mental health. 3. Exam format and duration. The EPPP is a computer-based test that typically takes about 4 hours to complete. Test takers have a set amount of time to answer questions, and they receive their scores once they finish the exam. 4. Scoring and passing. Each candidate must achieve a passing score, which is determined by each state board. The passing score varies, but is generally set to ensure that only those with sufficient knowledge and competencies can become licensed psychologists. 5. Retaking the exam. If a candidate does not pass the EPPP, they can retake the exam after a specified waiting period. This allows them time to review and improve their knowledge before attempting the exam again. Examples illustrating the EPPP1. Preparing for the exam. Taylor has just completed her doctoral degree in psychology and is ready to take the EPPP. To prepare, she joins a study group and uses practice tests to become familiar with the exam format and the types of questions she might encounter. With dedicated study, she feels confident on test day. 2. Understanding exam content. While preparing for the EPPP, Alex focuses on the section covering treatment planning and intervention strategies. He reviews various therapeutic techniques and case studies, which helps him answer related questions on the exam effectively. 3. Passing the EPPP. After taking the EPPP, Jessica receives her results and finds out she passed. With her successful exam completion, she is now eligible to apply for state licensure, a critical step towards starting her career as a licensed psychologist. Conclusion: the examination for professional practice in psychology is a crucial assessment for anyone looking to become a licensed psychologist. It tests the knowledge and skills needed for effective practice in the field of psychology. Understanding the format, content areas, and significance of the EPPP is important for your preparation for the CPC exam, as it highlights the rigorous standards set for professional practice in psychology. By passing the EPPP, future psychologists demonstrate their readiness to provide quality mental health services to individuals and communities. Accreditation. Council for the Accreditation of Counseling and Related Educational Programs. Let's explore the Council for the Accreditation of Counseling and Related Educational Programs. This organization plays a significant role in ensuring that counseling programs meet high educational standards. Here's a breakdown of key concepts, important details, and examples to help you understand this topic as you prepare for the CPC exam. Key Concepts 1. What is CACREP? The Council for the Accreditation of Counseling and Related Educational Programs is a nonprofit organization that accredits graduate programs in counseling and related fields. CACREP ensures that these programs provide quality education and training for future counselors. 2. Purpose of CACREP. The main purpose of CACREP is to set educational standards for counseling programs, which helps ensure that students receive a comprehensive education. Accreditation from CACREP indicates that a counseling program meets specific quality criteria. Important details. 1. Accreditation process. To become accredited by CACREP, a counseling program must go through a rigorous review process. This includes preparing a detailed self-study to demonstrate how the program meets CACREP standards, undergoing a site visit by CACREP evaluators who assess the program, faculty qualifications, resources, and student outcomes, receiving feedback and making necessary improvements based on the evaluation. 2. Educational standards. CACREP has established key standards that accredited programs must meet, including curriculum requirements. Programs must include core curriculum areas, such as counseling theories, ethics, human development, and multicultural counseling. Supervised clinical experience. Students must complete a certain number of supervised counseling hours in real-world settings to gain practical experience. Qualified faculty. Faculty members must have appropriate credentials and experience in counseling to provide quality education and mentorship. 3. Benefits of CACREP accreditation. Graduating from a CACREP-accredited program can enhance job prospects for counselors. Many employers prefer or require candidates to have completed a CACREP-accredited program because it assures them of the quality of education. Accreditation can also streamline the process of obtaining licensure, since CACREP programs are often aligned with the educational requirements set by state licensing boards. 4. Programs that CACREP accredits. CACREP accredits a variety of counseling-related programs, including those in clinical mental health counseling, school counseling, marriage and family therapy, rehabilitation counseling, and more. Examples illustrating CACREP 1. Choosing a graduate program. A student named Emily is interested in becoming a school counselor. She researches graduate programs and finds several CACREP-accredited programs. She decides to apply to these programs because she wants to ensure she receives the highest quality education and meets licensure requirements after graduation. 2. Benefits of attending an accredited program. After completing her degree from a CACREP-accredited program, Maria applies for a job as a mental health counselor. The hiring manager notes that Maria graduated from an accredited program, making her a more appealing candidate compared to applicants from non-accredited schools. 3. Program improvement. A counseling program at a university is up for reaccreditation. The faculty reviews their curriculum and realizes they need to strengthen their focus on multicultural counseling. They attend workshops, improve their course offerings, and successfully attain CACREP accreditation again, improving their program's reputation. Conclusion: the Council for the Accreditation of Counseling and Related Educational Programs is essential for ensuring quality in counseling education. By accrediting programs that meet high educational standards, CACREP helps prepare competent and effective counselors. Understanding the role and significance of CACREP is important for your preparation for the CPC exam, as it emphasizes the value of accreditation in fostering professional excellence in the field of counseling. Council on Rehabilitation and Education. Let's explore the Council on Rehabilitation Education. This organization plays a key role in setting standards for education and accreditation in the field of rehabilitation counseling. Here's a breakdown of key concepts, important details, and examples to help you understand this topic as you prepare for the CPC exam. Key concepts. 1. What is CORE? The Council on Rehabilitation Education is a nonprofit organization that is responsible for accrediting graduate programs in rehabilitation counseling. It was established to ensure that these programs meet specific educational and professional standards, which helps prepare students to become effective rehabilitation counselors. 2. Purpose of CORE. The main purpose of CORE is to promote excellence in rehabilitation counseling education. By providing accreditation to programs that meet their standards, CORE helps ensure that future counselors are well-trained and capable of assisting individuals with disabilities. Important details. 1. Accreditation process. To achieve accreditation from CORE, a rehabilitation counseling program must go through a thorough review process. This includes self-study. The program prepares a document demonstrating how it meets CORE's standards and requirements. Site visit. CORE evaluators conduct a visit to assess the program in person. They examine the curriculum, faculty qualifications, resources, and student outcomes. Feedback and improvements. Based on the evaluation, programs may receive suggestions for improvements before being granted or reaffirmed accreditation. 2. Educational standards. CORE sets specific standards that accredited programs must follow, including curriculum requirements. Programs must include essential topics such as foundations of rehabilitation counseling, ethics, assessment techniques, and clinical practices. Supervised practicum internship. Students must complete a practical experience working with clients under supervision to gain hands-on skills. Qualified faculty. Faculty members teaching the courses should have the necessary credentials and experience in rehabilitation counseling. 3. Benefits of CORE accreditation. Graduating from a CORE-accredited program can enhance a counselor's job prospects. Many employers prefer or require candidates from accredited programs, as this ensures the quality of education received. Accreditation may also accelerate the process of obtaining state licenses to practice, as many state boards recognize CORE-accredited programs as meeting educational requirements. 4. Programs that CORE accredits. CORE primarily focuses on rehabilitation counseling programs, including master's degrees for individuals pursuing careers as rehabilitation counselors, addiction counselors, and other related fields. Examples illustrating CORE 1. Choosing a graduate program. A student named Jake is interested in becoming a rehabilitation counselor. He searches for graduate programs and finds one that is accredited by CORE. He chooses this program because he wants to ensure he receives a high-quality education that meets the professional standards needed to succeed in his career. 2. Finding employment. After completing his master's degree from a CORE-accredited program, Michelle applies for a job at a rehabilitation center. The employer values her degree because it's from an accredited program, giving her an advantage over candidates from non-accredited schools. 3. Program enhancement. The faculty at a university is preparing for core accreditation renewal. They review their curriculum and realize they need to offer more training in technology used in rehabilitation counseling. They update their courses and implement new technology training, resulting in successful reaccreditation by CORE. Conclusion: the Council on Rehabilitation Education is fundamental in ensuring quality education in rehabilitation counseling. By accrediting programs that meet rigorous educational standards, CORE helps prepare skilled professionals capable of supporting individuals with disabilities. Understanding CORE's role and accreditation process will be beneficial for your preparation for the CPC exam, as it highlights the importance of high standards in the education of future counselors. Accreditation versus licensure. Let's break down the concepts of accreditation and licensure. Both terms are important in the fields of counseling and other professions, but they refer to different processes and purposes. Here's a simple explanation of each one, including key concepts, details, and examples to help you understand. Key concepts. 1. Accreditation. Definition. Accreditation is a process through which an educational program or institution is evaluated and recognized by a professional organization as meeting specific quality standards. Purpose. The main goal of accreditation is to ensure that educational programs provide a high-quality education that prepares students for their careers. Accreditation helps students and employers know that a program has met certain standards of excellence. 2. Licensure. Definition. Licensure is a legal process by which a government agency grants permission to an individual to practice a certain profession. This usually involves passing an exam and meeting specific educational and experience requirements. Purpose. The primary goal of licensure is to protect the public by ensuring that only qualified individuals can provide professional services. Licensure allows professionals to practice legally and often involves ongoing education requirements to maintain the license. Important details. 1. Accreditation. Who provides accreditation? Accreditation is usually granted by recognized professional organizations or accrediting bodies. For example, in the counseling field, organizations like the Council for the Accreditation of Counseling and Related Educational Programs accredit counseling programs. Impact on education. Attending an accredited program can enhance a graduate's job prospects, as many employers prefer or require candidates to have degrees from accredited institutions. It also ensures that a program meets specific educational standards, which can help students receive quality training. 2. Licensure. Who provides licensure? Licensure is typically granted by state or provincial government agencies or boards. Different states have different licensing requirements, and a license is often required to practice legally as a counselor or psychologist. Requirements. To obtain a license, individuals usually need to have an appropriate degree, complete a certain number of supervised hours of practice, and pass a licensing examination. For instance, in many states, aspiring counselors must pass the National Counselor Examination or a similar test. Examples illustrating accreditation and licensure. 1. Accreditation example. A university offers a master's degree program in counseling that is accredited by CACREP. This means that the program meets high-quality standards set by the organization. As a result, students who graduate from this program are more likely to be seen as well-prepared professionals by employers in the field. 2. Licensure example. After completing her accredited master's program in counseling, Anna needs a license to practice as a counselor. She applies for her state's licensure exam, and after passing it and completing her required supervised hours, she becomes a licensed professional counselor. This license allows her to work legally in her state and provide counseling services to clients. 3. Key differences. Accreditation is about the quality of educational programs, while licensure is about the legal permission to practice a profession. Accreditation helps ensure that students receive a good education, while licensure helps ensure that clients receive services from qualified professionals. Conclusion. Accreditation and licensure are both important in the fields of counseling and other professions, but they serve different purposes. Accreditation focuses on ensuring that educational programs meet high-quality standards, while licensure provides legal permission for individuals to practice professionally. Understanding the differences between these two concepts is crucial as you prepare for the CPC exam, as it highlights the importance of both quality education and professional qualifications in counseling. Benefits and disadvantages of accreditation. Let's discuss the benefits and disadvantages of accreditation in the context of educational programs, especially in fields like counseling. Accreditation is a process that evaluates and recognizes the quality of educational programs, ensuring they meet certain standards. Here's a breakdown of key concepts, important details, and examples that illustrate both the advantages and disadvantages of accreditation as you prepare for the CPC exam. Key concepts 1. Accreditation. Accreditation is a formal recognition by a professional body that an educational program meets specific quality standards. It is intended to ensure that students receive a quality education that prepares them for their careers. Benefits of accreditation 1. Quality assurance. Definition. Accreditation ensures that educational programs meet high-quality standards. Programs go through rigorous evaluations to confirm they are teaching the necessary knowledge and skills. Example. A counseling program accredited by CACREP is recognized for providing a strong education in counseling theories and ethics, which helps prepare students for their future careers. 2. Enhanced job opportunities. Definition. Graduating from an accredited program is often seen as a mark of quality by employers. Many employers prefer hiring candidates from accredited programs because they trust the education is credible. Example. When applying for a job, a counselor who graduated from a CACREP accredited program may have an advantage over candidates from non-accredited programs, making it easier to secure a position. 3. Licensure and certification. Definition. Many licensing boards require graduation from an accredited program to qualify for licensure. This ensures that candidates have received the necessary training for their profession. Example. In many states, aspiring counselors must have a degree from an accredited program to be eligible to take the National Counselor Examination for licensure. 4. Continuous improvement. Definition. The accreditation process often includes ongoing evaluations, which encourages programs to constantly improve and update their curriculum and practices. Example. A counseling program may revise its courses based on student feedback and changes in the field, ensuring that it remains relevant and provides quality education. Disadvantages of accreditation 1. Cost. Definition. The process of attaining and maintaining accreditation can be expensive for educational institutions. They often have to spend money on evaluations and improvements to meet accreditation standards. Example. A small university may face budget constraints and find it challenging to allocate funds for the accreditation process, which could impact their ability to offer certain programs. 2. Time-consuming process. Definition. The accreditation process can take a significant amount of time. Preparing for an accreditation review can require extensive documentation and adjustments, which can take away resources from teaching and student support. Example. Faculty members at a counseling program might be required to spend months preparing for the accreditation review, taking time away from their teaching responsibilities and student interaction. 3. Rigidity in curriculum. Definition. Accreditation standards may limit the flexibility of educational programs to innovate or adapt their curriculums. Programs might be required to stick closely to the established standards even if trends in the field change. Example. A counseling program may have to keep certain courses even if they're not the most relevant or effective for preparing students for modern counseling practices. 4. Potential for complacency. Definition. Some accredited programs may become complacent once they achieve accreditation, believing they no longer need to make changes or improvements. Example. A counseling program that has been accredited for several years may not update its curriculum or teaching methods, leading to outdated knowledge being taught to students. Conclusion accreditation offers several benefits, such as assuring quality education, enhancing job prospects, and providing a pathway to licensure. However, it also has some disadvantages, including costs, time commitment, and potential rigidity in curriculum. Understanding these benefits and drawbacks is essential for making informed decisions about educational programs as you prepare for the CPC exam, as they highlight the importance of accreditation in ensuring quality and relevance in counseling education. CACREP program requirements for NCC licensure. Let's break down the CACREP program requirements for the National Certified Counselor Certification and Licensure. This topic is important for understanding how educational programs prepare students for professional counseling. Here's an explanation that covers the key concepts, important details, and examples to help you succeed in your studies for the CPC exam. Key concepts 1. CACREP. CACREP is an organization that accredits counseling programs in colleges and universities. Accreditation means that a program meets specific educational standards, ensuring that students receive a quality education. 2. NCC. The NCC is a certification awarded by the National Board for Certified Counselors that demonstrates a counselor's qualifications and competence in the field. To become an NCC, you usually need to complete a CACREP accredited program and pass an exam. 3. Licensure. Licensure is the legal permission to practice as a counselor. Each state has its own requirements for obtaining a license, which generally includes having a degree from an accredited program, completing supervised clinical hours, and passing a licensure exam. CACREP program requirements. Programs accredited by CACREP have specific requirements that help prepare students for becoming licensed counselors and certified counselors. Here are the main requirements. 1. Educational curriculum. Core areas. CACREP accredited programs must cover key content areas essential for effective counseling. These areas include human growth and development, understanding how individuals develop at different life stages, social and cultural foundations, exploring how culture, diversity, and social justice impact mental health and counseling, helping relationships, learning different counseling techniques and theories, group work, understanding group dynamics and how to facilitate group therapy, career development, learning about career counseling and job placement, assessment, gaining knowledge on how to assess client needs and progress, research and program evaluation, understanding research methods and how to evaluate counseling programs. 2. Practical experience, supervised internships. Students must complete a significant amount of supervised clinical experience through internships or practicums. This practical training is crucial for applying theory to real-world situations. Hours requirement. CACREP typically requires students to complete a minimum of 600 hours of supervised counseling experience, with a substantial portion involving direct client contact. 3. Competency areas. CACREP programs also focus on developing specific competencies that counselors must have, such as ethical understanding and application, knowing ethical guidelines, and how to apply them in practice. Advocacy for clients. Learning how to support clients in accessing resources and services. Crisis intervention skills. Preparing to help clients in distressing situations. Path to NCC and Licensure 1. Completing a CACREP accredited program. Graduating from a CACREP accredited program is often a prerequisite for obtaining the NCC certification and state licensure. This education ensures that candidates are well prepared for the challenges they will face in the counseling field. 2. Passing the necessary exams. After completing the CACREP accredited program, candidates must pass the National Counselor Examination or a similar exam to earn the NCC certification. This exam tests their knowledge of counseling practices and theories. 3. Applying for licensure. Once candidates have completed their education and passed the NCE, they can apply for licensure in their state. Each state may have different additional requirements, so it's important to check with the local licensing board. Example 1. Danielle's journey. Danielle is pursuing her master's degree in counseling at a CACREP accredited university. Her program covers all the required curriculum areas, including group counseling, assessment, and ethical practices. She completes her 600 hours of supervised internship at a local mental health clinic, gaining valuable hands-on experience. After graduating, Danielle takes and passes the NCE, earning her NCC certification. She then applies for licensure in her state, where she meets all the local requirements, including submitting her internship details. Finally, she becomes a licensed professional counselor, ready to start her career. Conclusion: the CACREP program requirements play a vital role in preparing students for the National Certified Counselor Certification and state licensure. By ensuring comprehensive curricula, practical experience, and the development of specific competencies, CACREP accredited programs equip future counselors with the knowledge and skills needed to succeed in their professional careers. Understanding these requirements is crucial for successful preparation for the CPC exam, as they outline the essential steps to becoming a licensed and certified counselor. 3. Diagnosis and Assessment Diagnostic Systems. Diagnostic and Statistical Manual of Mental Disorders, DSM. 5 mentioned. Let's explore the Diagnostic and Statistical Manual of Mental Disorders, specifically the DSM-5. This manual is an essential tool used by mental health professionals to diagnose mental disorders. Understanding the DSM-5 is important for your studies, especially as you prepare for the CPC exam. Here's a breakdown of the key concepts, important details, and examples that will help you understand this topic. Key Concepts 1. What is the DSM? The Diagnostic and Statistical Manual of Mental Disorders is a book published by the American Psychiatric Association. It provides standard criteria for the classification and diagnosis of mental disorders. The DSM is used by psychologists, psychiatrists, social workers, and other mental health professionals. The DSM-5, which stands for the 5th edition of the manual, aims to improve the accuracy and consistency of mental health diagnoses. It serves several important functions, helps clinicians identify mental health disorders based on specific symptoms, provides a common language for professionals to communicate about mental health issues, aids in research by standardizing the definitions and criteria for mental disorders. Important details 1. Structure of the DSM-5. The DSM-5 is organized into 3 main sections. Section 1. Basics. This part introduces the manual, explains how to use it, and discusses the importance of cultural considerations in diagnosis. Section 2. Diagnostic criteria and codes. This is the main part of the DSM-5 and includes specific diagnostic criteria for each recognized mental disorder. Each disorder includes information on its symptoms, diagnostic features, and prevalence. Section 3. Emerging measures and models. This section contains tools and assessments that can help with diagnosis and treatment. It also includes information on disorders that are still being researched and may not yet have formal criteria. 2. Diagnostic criteria. Each mental disorder listed in the DSM-5 has specific criteria that must be met for a diagnosis. These criteria include symptoms, the specific feelings, thoughts, or behaviors that indicate the presence of a disorder. Duration, how long the symptoms must last to qualify for a diagnosis. Impact, how the symptoms affect daily functioning, relationships, and overall well-being. 3. Categories of mental disorders. The DSM-5 categorizes mental disorders into several groups. Some major categories include anxiety disorders, disorders characterized by excessive fear or worry. Mood disorders, disorders that affect mood and emotions. Personality disorders, enduring patterns of behavior and thinking that differ significantly from cultural norms. Psychotic disorders, disorders that involve a loss of contact with reality. Examples illustrating DSM-5 Concepts 1. Anxiety disorder example. Suppose a person feels excessive worry about everyday situations, such as work or personal relationships, that last for months. According to the DSM-5, they might meet the criteria for generalized anxiety disorder if they experience additional symptoms like restlessness, fatigue, difficulty concentrating, and sleep disturbances. 2. Mood disorder example. Imagine an individual who experiences persistent feelings of sadness, loss of interest in activities, and changes in sleep and appetite for more than 2 weeks. These symptoms might indicate major depressive disorder, as defined by the DSM-5. If diagnosed, the clinician would use the DSM-5 criteria to determine the severity and develop a treatment plan. 3. Understanding diagnosis. A mental health professional uses the DSM-5 during therapy sessions to evaluate a client's symptoms. For instance, if someone reports intense mood swings, periods of high energy, and impulsive behavior, the therapist would refer to the DSM-5 to consider a diagnosis such as bipolar disorder. Conclusion: the Diagnostic and Statistical Manual of Mental Disorders is a crucial resource for mental health professionals for diagnosing and classifying mental disorders. It provides clear criteria for various disorders, helping to ensure accurate and consistent diagnoses. By understanding the structure, criteria, and categories of the DSM-5, you will be better prepared for the CPC exam and future practice in the field of counseling. International Classification of Diseases. Let's explore the International Classification of Diseases. This is an important coding system that healthcare providers use to classify and track diseases and health conditions. Understanding the ICD is vital for mental health professionals and is helpful for your preparation. For the CPC exam, here's a breakdown of the key concepts, important details, and examples to clarify the topic. Key Concepts 1. What is the ICD? The International Classification of Diseases is a system developed by the World Health Organization that provides codes for various diseases, health conditions, and other related issues. It is used worldwide to standardize the collection and reporting of health information. 2. Purpose of the ICD. The main purposes of the ICD are standardization, to create a uniform way to classify diseases and health-related issues, making it easier to share data internationally. Statistics, to provide a basis for reporting and analyzing health trends globally. This information helps governments and organizations in healthcare planning and resource allocation. Insurance and billing, to guide healthcare providers in coding diagnoses for billing insurance companies and ensuring proper reimbursement for services rendered. Important details 1. Versions of the ICD. The ICD has gone through several revisions. The current version is ICD-11, which was officially released by the WHO in 2019. Some key features include: it contains new codes for diseases and incorporates modern medical knowledge. The transition from ICD-10 to ICD-11 offers more flexibility and detail, allowing for better classification of health conditions. 2. Structure of the ICD. The ICD is organized into chapters based on different categories of diseases and conditions. Each entry includes code, a unique alphanumeric code that represents a specific disease or health issue. Description, a detailed explanation of the disease, including its characteristics and symptoms. 3. Mental health and the ICD. The ICD includes a specific chapter dedicated to mental, behavioral, and neurodevelopmental disorders. This chapter covers various conditions, such as depressive disorders, anxiety disorders, bipolar disorder, schizophrenia. Each of these disorders has its own code, making it easier for professionals to diagnose and report them accurately. Examples illustrating ICD concepts. 1. Using ICD codes in practice. A therapist working with a client diagnosed with major depressive disorder would use the ICD code F32 for a specific episode of depression. This code helps document the diagnosis in clinical records and is essential for billing insurance. 2. Reporting health statistics. Public health departments might use ICD codes when collecting data about illness trends. For instance, if there's an increase in the number of cases coded as I-63, this information can lead to further investigation into possible causes or outbreaks and guide healthcare responses. 3. Mental health treatment planning. A psychologist who assesses a client and determines they have generalized anxiety disorder, coded as F41.1, can develop treatment plans tailored specifically for that diagnosis. The code helps ensure that therapists are aware of the symptoms and typical treatment strategies associated with that disorder. Conclusion: the International Classification of Diseases is a key tool used worldwide to classify and report diseases and health conditions, including mental health disorders. It provides standardized codes that help healthcare professionals communicate effectively, conduct research, and secure funding for services. By understanding the structure and purpose of the ICD, you will be better prepared for your studies and future work in the counseling field, including its relevance to the CPC exam. Nosology. Let's explore the topic of nosology, which refers to the system of classification for diseases and health conditions. Understanding nosology is important in fields like psychology, medicine, and counseling, especially as it relates to diagnosing and treating different disorders. Here's a simplified breakdown of key concepts, important details, and examples to help you grasp this topic for the CPC exam. Key concepts. 1. What is nosology? Definition. Nosology is the branch of medicine that deals with the classification and naming of diseases. It helps organize knowledge about diseases, making it easier for healthcare professionals to identify and treat them. Purpose. The main purpose of nosology is to create a standardized system for naming diseases, which aids in communication, research, and treatment. 2. Classification systems. Nosology uses classification systems that categorize diseases based on various criteria, such as etiology, the cause of the disease; symptoms, the specific signs and symptoms that characterize the disease; anatomical location, where the disease occurs in the body; course of illness, how the disease progresses. Important details. 1. Common nosology frameworks. Several well-known classification systems are used in nosology, including ICD, a system developed by the World Health Organization, providing codes for various diseases and health conditions; DSM, a manual used primarily in the United States for classifying mental health disorders. The latest version is DSM-5, which includes specific criteria for diagnosing different mental disorders. 2. Benefits of nosology. Improves communication. By having a common language for diseases, healthcare professionals from different areas can understand and discuss conditions more effectively. Facilitates research. Standardized classifications help researchers study and compare diseases, leading to better understanding and treatment options. Guides treatment. Accurate classification can help healthcare providers choose appropriate treatment plans based on the specific disease type. 3. Challenges in nosology. Complexity of diseases. Some diseases may not fit neatly into categories because they have multiple causes or manifest in different ways. Cultural differences. Different cultures may have unique understandings and classifications of diseases, which can complicate global healthcare communication. Evolving knowledge. As new research emerges and our understanding of diseases evolves, classification systems may need to be updated, which can be challenging. Examples illustrating nosology concepts. 1. Example of a physical illness. Consider type 2 diabetes, a chronic condition classified under the ICD. Etiology. The cause is often related to lifestyle factors, such as poor diet and lack of exercise. Symptoms. Common symptoms include increased thirst, frequent urination, and fatigue. Anatomical location. It mainly affects the pancreas and how the body uses insulin. 2. Example of a mental health disorder. Major depressive disorder can be classified using the DSM-5. Symptoms. Symptoms include feelings of sadness, loss of interest in activities, and changes in sleep and appetite. Course of illness. It can be classified as either a single episode or recurrent episodes. 3. Example of research and treatment. Researchers conducting a study on depression can use the DSM-5 criteria to ensure that all participants meet the same diagnostic criteria. This standardization helps them analyze the effectiveness of different treatments and share findings with other professionals. Conclusion. Nosology is the science of classifying and naming diseases, which is crucial for understanding health conditions in psychology and medicine. By using established classification systems like the ICD and DSM, healthcare professionals can communicate effectively, conduct research, and develop appropriate treatment plans. Understanding nosology will enrich your knowledge base as you prepare for the CPC exam and your future work in counseling and mental health. Medical model influence. Let's explore the medical model influence in the context of healthcare and mental health. The medical model is a way of understanding and treating health conditions that focuses on diagnosing and treating specific diseases or disorders. It has had a significant impact on how we view health, illness, and healthcare practices. Here's a breakdown of the key concepts, important details, and examples to help you understand this topic for your CPC exam. Key concepts. 1. What is the medical model? Definition. The medical model views health issues primarily as problems that can be diagnosed, treated, and cured, similar to how we treat physical diseases. It emphasizes biological factors, such as genetics and physiology, in explaining health conditions. Focus. This model focuses on identifying specific diseases or disorders, understanding their causes, and developing treatments, typically through medication or medical procedures. 2. Historical context. The medical model became prominent in the 19th and 20th centuries, largely due to advances in medical science and technology. It emphasized the need for scientific evidence and objective data in understanding health issues. Important details. 1. Characteristics of the medical model. Diagnosis. The first step is diagnosing the condition based on observed symptoms and medical tests. For example, if a patient has symptoms of high blood pressure, doctors will use medical tests to confirm the diagnosis. Treatment. After diagnosis, treatment usually involves medical interventions, such as medication, surgery, or therapy aimed at resolving the specific condition. Focus on biology. The model tends to prioritize biological explanations over psychological or social factors. This means it looks for physical causes of disease rather than considering emotional or environmental influences. 2. Impact on healthcare. Standardized practice. The medical model has led to standardized processes for diagnosing and treating health conditions across healthcare settings, making it easier for professionals to work together and for patients to receive consistent care. Advancements in medicine. Many medical advancements, including vaccines, antibiotics, and surgical techniques, are rooted in the medical model, improving overall health outcomes significantly. 3. Criticism of the medical model. Neglecting psychological and social factors. Critics argue that the medical model often overlooks important psychological, social, and cultural factors that can influence health. For example, mental health issues may not only arise from biological problems, but also from environmental stressors or trauma. Patients as passive recipients. In a medical model, patients are often seen as passive recipients of treatment, rather than active participants in their care. This can affect patient empowerment and involvement in decision-making about their health. Examples illustrating medical model influence. 1. Physical health example. Consider a patient diagnosed with diabetes. The medical model would focus on diagnosing the type of diabetes, understanding the biological factors, and prescribing medications to manage blood sugar levels. The focus would primarily be on the physical aspects of the disease. 2. Mental health example. When treating major depressive disorder, the medical model would involve diagnosing the disorder based on specific symptoms and possibly prescribing antidepressant medication. While this can be effective, it may not fully address underlying psychological factors, such as past trauma or current life stressors, that contribute to the patient's depression. 3. A balanced approach. Many healthcare professionals today advocate for a more integrated approach that combines the medical model with other perspectives, such as the biopsychosocial model. This approach considers biological, psychological, and social factors in understanding and treating health conditions. For example, a treatment plan for a patient with anxiety might include therapy along with medication. Conclusion. The medical model influence has significantly shaped how we understand and treat health conditions, emphasizing diagnosis and biological treatment. While it has led to many advancements in healthcare, it is important to recognize its limitations and consider broader perspectives that address psychological and social factors. Understanding this influence will enhance your knowledge as you prepare for the CPC exam and your future career in counseling or mental health. V-codes. Let's explore V-codes, which are used in the context of mental health and counseling. V-codes are specific codes found in the Diagnostic and Statistical Manual of Mental Disorders that refer to conditions and situations that can affect a person's mental health but are not classified as mental disorders. Understanding V-codes is essential as they provide insight into factors that can influence a person's mental and emotional well-being. Here's a breakdown of the key concepts, important details, and examples to help you understand this topic for the CPC exam. Key concepts. 1. What are V-codes? Definition. V-codes are used to identify problems or situations that may contribute to mental health issues, but do not qualify as mental disorders. They help mental health professionals understand the context of a person's experience. Purpose. These codes allow for better documentation and communication regarding the factors influencing a client's mental health, which can aid in treatment planning and interventions. 2. Where are V-codes found? V-codes are included in the DSM-5, which mental health professionals use for diagnosing mental health disorders. They provide additional information that is relevant to a person's overall health and treatment. Important details. 1. Examples of V-codes. V-codes cover a variety of situations and problems, including acculturation problems. These refer to difficulties that a person may face when adapting to a new culture. For example, an immigrant might struggle with language barriers, loss of social support, or cultural differences that affect their emotional well-being. Occupational problems. These issues relate to challenges that someone may face in their job or workplace, such as job dissatisfaction, work-related stress, or conflicts with coworkers. For instance, if someone feels overwhelmed and unsupported in their new role, this could impact their mental health. Academic problems. These codes apply to issues related to a person's educational experience, such as academic underachievement, difficulties with learning, or problems with peer relationships at school. For example, a student facing bullying or struggling with their studies might be coded for academic problems. 2. Importance of V-codes in treatment. Contextual understanding. Using V-codes helps counselors and therapists understand the broader context of a client's life. Addressing these situational issues can be crucial for effective treatment. Holistic approach. V-codes encourage a more holistic view of mental health by recognizing that factors outside of diagnosed disorders can significantly affect a person's mental well-being. 3. How V-codes are used. When a mental health professional assesses a client, they may include V-codes in their documentation to indicate any relevant situational problems that could impact the client's mental health. This information can help inform treatment strategies and goals. Exemples illustrating codes 1. Acculturation problem example. A teenager named Anna recently moved to a new country with her family. She struggles with a language barrier and feels isolated from her peers at school. Her therapist might use the V-code for acculturation problem to acknowledge the challenges Anna faces in adapting to a new culture. This helps the therapist understand Anna's feelings of anxiety and sadness in the context of her transition. 2. Occupational problem example. Consider David, who has recently started a new job but feels constantly stressed due to unrealistic deadlines and lack of support from his manager. If David seeks therapy, the therapist may document an occupational problem using a V code. Acknowledging this situation allows the therapist to help David develop coping strategies for managing work-related stress. 3. Academic problem example. Jessica is a college student who is having difficulty keeping up with her coursework due to personal issues at home. In therapy, this may be identified as an academic problem, V code. Recognizing this issue ensures that her therapist considers all factors influencing her academic performance and provides appropriate support. Conclusion V codes play an essential role in the assessment and treatment of clients by identifying situational problems that may affect their mental health. Understanding and using V codes helps counselors provide a more comprehensive approach to treatment, taking into account the broader context of an individual's life. By recognizing factors like acculturation problems, occupational issues, and academic challenges, mental health professionals can better support their clients. Familiarity with V codes will be beneficial as you prepare for the CPC exam and future work in counseling. Diagnostic codes. Let's explore diagnostic codes and their format, which are used in healthcare to identify diseases, conditions, and health-related issues. Understanding diagnostic codes is essential for professionals in mental health and counseling, especially for accurate record-keeping, billing, and treatment planning. Here's a breakdown of key concepts, important details, and examples to help you understand this topic as you prepare for the CPC exam. Key concepts 1. What are diagnostic codes? Definition. Diagnostic codes are alphanumeric codes used in healthcare to represent specific diagnoses, diseases, or health conditions. These codes help standardize the way medical professionals classify and communicate about health issues. Purpose. The main purpose of diagnostic codes is to ensure accurate documentation, facilitate billing and insurance claims, and track health statistics. 2. Types of diagnostic codes. The two primary systems for diagnostic coding are ICD, developed by the World Health Organization. This system is used globally to classify diseases and health conditions. DSM. This manual is specific to mental health and is widely used in the United States to classify mental disorders. Important details 1. Format of diagnostic codes. ICD codes. ICD codes are typically alphanumeric and use a specific format. Structure. A standard ICD code consists of a letter followed by a series of numbers, such as 11.9. The letter indicates the chapter of the classification. For example, E refers to endocrine, nutritional, and metabolic diseases. The numbers following the letter provide more specific information about the condition. For instance, E11.9 specifies type 2 diabetes without complications. DSM codes. DSM codes also use a similar structure. Structure. They are often formatted as a J, followed by a 3-digit number, for example, F32.0 or F41.1. This format helps identify specific mental health disorders based on criteria set by the DSM. 2. How diagnostic codes are used. Documentation. Healthcare providers use diagnostic code to document a patient's diagnosis in medical records. This helps maintain accurate and standardized information. Billing. When healthcare services are provided, diagnostic codes are used for billing purposes. Insurance companies require these codes to process claims and reimburse healthcare providers. Research and public health. Diagnostic codes are used in research to analyze health trends and improve public health initiatives. For instance, tracking the prevalence of certain diseases can help in resource allocation and healthcare planning. 3. Importance of accurate coding. Accurate coding is crucial for several reasons. Ensures that patients receive the appropriate treatment based on their diagnosed conditions. Allows healthcare providers to communicate effectively about patient care and treatment plans. Affects funding and resources for healthcare facilities based on the diagnosed conditions of the patients they serve. Examples illustrating diagnostic codes. Format 1. Example of an ICD code. ICD-10 code for hypertension. An example of an ICD code is I-10, which represents essential hypertension. In this case, I indicates that the code relates to diseases of the circulatory system, while 10 specifies the particular condition of essential hypertension. 2. Example of a DSM code. DSM-5 code for major depressive disorder. The DSM-5 code for major depressive disorder might be F33.1. Here, F indicates that the disorder is mental or behavioral, and 33.1 specifies recurrent major depressive disorder with a current episode of moderate severity. 3. International use of codes. In a hospital setting, a patient with major depressive disorder might also need to be treated for physical health issues. If they are diagnosed with hypertension, a healthcare provider would document both codes to ensure that all aspects of the patient's health are addressed. Conclusion diagnostic codes are essential tools used in healthcare to classify and communicate about diseases, health conditions, and mental disorders. They have a specific format, either numeric or alphanumeric, depending on the classification system used. Accurate diagnostic coding is crucial for documentation, billing, and research, and it ensures that patients receive effective and appropriate care. Understanding how diagnostic codes work will enhance your knowledge as you prepare for the CPC exam and your future role in counseling and mental health. Hoarding disorder and OCD sharing a code. Let's delve into hoarding disorder and its relationship with obsessive-compulsive disorder, particularly regarding how they share a diagnostic code. Understanding these concepts is beneficial for your studies, especially as you prepare for the CPC exam. Here's a clear breakdown of the key concepts, important details, and examples. Key concepts 1. What is hoarding disorder? Definition. Hoarding disorder is a mental health condition characterized by persistent difficulty discarding or parting with possessions, regardless of their actual value. People with this disorder often feel a strong emotional attachment to their belongings and may experience distress at the idea of getting rid of them. Symptoms. Common symptoms include accumulating items to the point where living spaces become unlivable, experiencing anxiety or distress when attempting to discard items or when items are removed, a belief that one needs to save items or that others might need them in the future. 2. What is obsessive-compulsive disorder? Definition. OCD is a mental health disorder characterized by the presence of obsessions and compulsions. Symptoms. Symptoms include obsessions, such as fears of harm or contamination. Compulsions, such as repeated hand-washing, checking, or organizing. 3. Connection between hoarding disorder and OCD. Hoarding disorder is categorized as a type of OCD, although both disorders involve anxiety and compulsive behaviors. Hoarding specifically focuses on the difficulty in discarding items and the excessive accumulation of possessions. Important details: ICD-10 code. In the ICD-10, hoarding disorder and OCD share a similar code structure because they are related. Hoarding disorder is classified under the OCD category. For example, in the DSM-5, hoarding disorder is coded as F42. 3, which indicates it is part of the spectrum of obsessive-compulsive disorders. 2. Diagnosis and treatment. Diagnosis. Professionals use specific criteria to diagnose hoarding disorder, observing how it affects daily functioning and determining if it meets the threshold for a mental disorder. Treatment options. Treatment often includes cognitive behavioral therapy, a common approach that helps individuals change negative thoughts and behaviors related to their possessions. Medication. Selective serotonin reuptake inhibitors are sometimes prescribed to help manage symptoms of anxiety and depression associated with hoarding and OCD. Examples illustrating hoarding disorder and OCD-1. Example of hoarding disorder. John's case. John struggles with hoarding disorder. His home is filled with newspapers, old clothes, and various objects. Even though he knows others see his home as cluttered, he feels anxious and believes he might need these items someday. This causes significant distress and interferes with his ability to live comfortably. 2. Example of OCD. Sarah's case. Sarah has OCD, characterized by intrusive thoughts about germs and contamination. She engages in compulsive washing of her hands multiple times after touching anything outside her home. This behavior is driven by her anxiety about germs, and it interferes with her daily life. 3. Shared code context. A therapist diagnoses John with hoarding disorder because he exhibits symptoms related to the accumulation of items. If a different client, like Sarah, shows signs of both obsessions about cleanliness and hoarding tendencies, a therapist might address both aspects under the shared diagnostic framework, as they are interconnected. Conclusion: hoarding disorder and obsessive-compulsive disorder are closely related mental health conditions that share a diagnostic code in classification systems like the ICD-10. Hoarding disorder specifically involves the accumulation of items and difficulty discarding them, while OCD encompasses a broader range of obsessive thoughts and compulsive behaviors. Understanding these disorders, their symptoms, and how they relate will be valuable as you prepare for the CPC exam in your future work in the mental health field. Assessment practices. Use of assessment data. Let's explore the use of assessment data in the context of counseling and mental health. Assessment data refers to the information collected about a client through various testing and evaluation methods. Understanding how to effectively use this data is crucial for mental health professionals and is important for your preparation for the CPC exam. Here's a breakdown of the key concepts, important details, and examples. Key concepts 1. What is assessment data? Definition. Assessment data is information gathered to evaluate a client's mental health, behavior, and functioning. This data can come from interviews, questionnaires, tests, and observations. Purpose. The purpose of collecting assessment data is to better understand a client's needs, strengths, and challenges, which helps in developing effective treatment plans. 2. Types of assessment data. There are several types of assessment data used in counseling, including self-report surveys. Clients answer questions about their thoughts, feelings, and behaviors. Behavioral observations. The counselor observes the client's behavior in different settings. Standardized tests. Formal tests that measure specific mental health issues or personality traits. Clinical interviews. Structured or unstructured conversations between the counselor and the client to gather information about their life and concerns. Important details 1. Collecting assessment data. Mental health professionals use various methods to collect assessment data, depending on the context and goals of the assessment. This may involve using multiple methods to get a well-rounded view of the client. 2. Interpreting assessment data. Analysis. Once collected, counselors analyze the data to identify patterns, strengths, and areas needing attention. This analysis helps clarify the client's issues. Contextual understanding. It's important for counselors to consider the context of the data. For example, a client's score on a depression scale might be affected by recent life events, so understanding this context is critical for accurate interpretation. 3. Using assessment data in treatment planning. Goal setting. The information collected helps counselors set specific, achievable goals for therapy. For instance, if assessment data shows a client has high anxiety levels, the treatment plan may focus on anxiety reduction techniques. Monitoring progress. Counselors can also use assessment data to track a client's progress over time. Regular assessments can help determine if the client is improving, if adjustments to the treatment plan are necessary, or if different interventions are needed. Examples illustrating the use of assessment data 1. Example of a self-report survey. Maria's case. Maria fills out a self-report survey that measures her anxiety levels. Her scores indicate moderate anxiety. After discussing the results in therapy, the counselor decides to incorporate relaxation techniques into their sessions to help Maria manage her anxiety more effectively. 2. Example of a standardized test. James's case. James takes the MMPI, a standardized personality test. The results highlight traits related to depression and social introversion. The counselor uses this information to guide discussions around James's feelings, experiences, and social interactions during therapy sessions. 3. Example of monitoring progress. Lisa's therapy. Lisa initially scored high on a depression inventory when she started therapy. After several months of therapy and a focus on cognitive behavioral techniques, her counselor reassesses her using the same inventory. The follow-up results show a significant decrease in her depression score, indicating progress. This information helps the counselor and Lisa celebrate her achievements and adjust goals going forward. Conclusion: the use of assessment data is essential in counseling as it provides vital information to help understand a client's mental health needs and guide treatment planning. By collecting, interpreting, and utilizing this data, mental health professionals can create tailored treatment approaches, track progress, and adjust strategies as needed. Familiarity with assessment data will enhance your skills as you prepare for the CPC exam and your future career in counseling. Outdated tests. Let's discuss outdated tests in the context of psychological and educational assessments. Outdated tests are those that are no longer considered valid or reliable for measuring the traits or abilities they were designed to assess. Understanding this topic is important for recognizing the evolution of assessment tools and ensuring that mental health professionals use the best methods for evaluating clients. Here's a breakdown of key concepts, important details, and examples related to outdated tests. Key concepts 1. What are outdated tests? Definition. Outdated tests are assessments that have not kept up with current research or standards in psychology and education. They may provide inaccurate, biased, or irrelevant results due to changes in understanding about human behavior and mental processes. Reasons for being outdated. Tests can become outdated for several reasons. New research reveals flaws in the test design or implementation. Societal changes affect what is considered relevant or appropriate for assessment. Advances in technology and psychology lead to better methods for evaluation. 2. Impact of outdated tests. Using outdated tests can lead to incorrect diagnoses, inappropriate treatment plans, and ineffective interventions. For example, if a mental health professional uses an outdated test to assess a client's intelligence, it may not accurately reflect that person's current cognitive abilities or potential. Important details. 1. Examples of outdated tests. Rorschach inkblot test. While still used by some clinicians, this test, which involves interpreting inkblots, has come under criticism for lack of empirical support and validity. Many psychologists question whether it truly measures personality or if it can lead to subjective interpretations based on the administrator's biases. Stanford-Binet test. While the Stanford-Binet test has been revised and updated several times, earlier versions were criticized for cultural bias and not accurately reflecting the abilities of individuals from diverse backgrounds. 2. Consequences of using outdated tests. Inaccurate assessment. Relying on outdated tests can result in incorrect conclusions about a client's abilities or disorders. For example, an outdated intelligence test might underestimate someone's cognitive skills, affecting educational and career opportunities. Negative effects on treatment. If a therapist bases treatment on outdated assessments, the strategies used may not be suitable for the client's current needs, potentially leading to ineffective or harmful interventions. 3. Importance of using current tests. Validity and reliability. Current assessments have undergone rigorous testing to ensure they measure what they claim to measure and produce consistent results over time. For example, modern assessments utilize standardized procedures and appropriate norms for diverse populations. Cultural sensitivity. Newer tests are often designed with more cultural sensitivity, making them fairer and more representative of individuals from various backgrounds. Examples illustrating outdated tests. 1. Example of Rorschach inkblot test. A therapist uses the Rorschach test to assess a client's personality. The results may be subjective and vary based on the therapist's interpretation. Many psychologists argue that these interpretations lack scientific backing and may lead to misleading conclusions about the client's mental health. 2. Example of an old intelligence test. Imagine a school counselor using an outdated version of the Stanford-Binet test to evaluate a student's learning abilities. This test may not accurately reflect newer educational practices or the needs of diverse learners, causing the counselor to overlook necessary support the student requires. Conclusion: outdated tests can hinder effective assessment and treatment in psychology and education. As our understanding of human behavior, cognitive abilities, and cultural diversity evolves, it is essential to use current assessments that are valid, reliable, and appropriate for the population being assessed. Awareness of outdated tests and their limitations is crucial for mental health professionals and will be valuable as you prepare for the CPC exam and your future career in counseling. Always prioritize using the most up-to-date and relevant assessment tools to provide the best care for clients. Standardized testing. Let's explore standardized testing, particularly focusing on the concepts of repeating questions and wording. Standardized testing is a method used to measure students' or individuals' knowledge, skills, and abilities in a consistent way. Understanding how these tests work and the importance of question design can help you appreciate the implications of assessment practices in education and mental health. Here's a breakdown of the key concepts, important details, and examples. Key concepts. 1. What is standardized testing? Definition. Standardized testing refers to uniform tests that are administered and scored in a consistent manner. These tests measure a range of skills or knowledge across all test takers using the same questions and score criteria. Purpose. The main purpose of standardized tests is to evaluate student performance, compare results across different groups, and assess educational systems' effectiveness. 2. Repeating questions. Definition. In the context of standardized tests, repeating questions refers to the practice of asking the same or very similar questions in different parts of the test or across different tests. This can help to reinforce key concepts and ensure that test takers understand the material. Example: a math standardized test might include several questions that require solving problems using the same formula, but with different numbers. This method checks a student's mastery of a concept without introducing entirely new material. 3. Wording of questions. Importance. The wording of questions on standardized tests is crucial because it can affect how test takers understand and answer the questions. Clear, concise wording leads to better comprehension, while confusing language can result in misunderstandings and inaccurate assessments. Example: a question that asks, "Which of the following is an example of a habitat?" should be straightforward. If the wording is overly complex or uses jargon that students might not understand, it may confuse them and impact their performance. Important details. 1. Advantages of standardized testing. Consistency. Standardized tests provide a fair way to assess students since everyone answers the same questions under similar conditions. This ensures that results can be compared across different schools or districts. Objective measurement. These tests aim to provide an objective measure of knowledge and skills, minimizing bias that can occur in subjective assessments, such as essays or open-ended questions. 2. Criticism of standardized testing. Over-reliance on testing. Critics argue that focusing too much on standardized tests can lead to teaching to the test, where instructors prioritize test-related material over a broader understanding of the subject matter. Potential bias. If questions are not worded clearly or are culturally biased, they may advantage some groups over others, leading to unfair assessments of students' true abilities. 3. Designing effective questions. Alignment with learning objectives. Questions should align with what students are expected to learn. For example, if a learning objective is to understand fractions, then questions should directly assess this skill. Clear and precise language. Using straightforward language helps ensure that students understand what is being asked. Reducing unnecessary complexity can minimize misunderstandings and anxiety during testing. Examples illustrating standardized testing concepts. 1. Example of repeating questions. In a science standardized test, one section might ask, "What happens to the temperature of water when it is heated?" And another section might ask, "If the water is heated, what would you expect to occur to its temperature?" Both questions test the same concept of temperature change, but use different wording to ensure comprehension. 2. Example of poor wording. A poorly worded question might be, "Which of the subsequent alternatives accurately epitomizes the concept of biodiversity?" This could confuse students. Instead, a better version might be, "What does biodiversity mean?" This simpler wording is more likely to be understood by all test takers. 3. Example of clear question design. A math test might include a question like, "If you have 3 apples and you buy 2 more, how many apples do you have in total?" This is clear and checks basic addition skills effectively. The wording is simple and avoids any ambiguous terms. Conclusion: standardized testing is an important tool in assessing knowledge and skills consistently across various settings. Understanding the significance of repeating questions and the careful wording of questions can enhance the effectiveness of these assessments. Clear language and well-designed questions help ensure that tests accurately measure what students know without causing confusion. Recognizing these concepts will prepare you for discussions and considerations around testing practices as you prepare for the CPC exam in your future career in counseling or education. Interpreting test scores. Let's explore interpreting test scores in the context of assessments used in education and psychology. Understanding how to read and analyze test scores is essential for making informed decisions about a person's abilities, needs, and the effectiveness of interventions. Here's a breakdown of the key concepts, important details, and examples that will help you grasp this topic as you prepare for the CPC exam. Key concepts. 1. What are test scores? Definition. Test scores are the numerical values or results obtained from an assessment. They indicate how a person performed on the test compared to a standard or other individuals. Types of scores. Different types of scores may include raw scores, the total number of correct answers or points earned on the test. Scaled scores. These scores adjust raw scores to account for variations in test difficulty, allowing for fair comparisons across test versions. Percentiles. A way to understand how a test score compares to others. For example, a percentile rank of 75 means the person scored better than 75% of test takers. 2. Why interpret test scores? Assessment of skills. Interpreting test scores helps professionals understand a person's strengths and weaknesses, which is crucial for planning effective interventions or learning strategies. Comparisons. Test scores allow comparisons between individuals or groups. aiding in identifying areas needing improvement or support. Important details. 1. Understanding percentiles. Percentiles indicate the percentage of test takers who scored lower than the individual in question. For example, if a student is in the 60th percentile, it means they performed better than 60% of the students who took the same test. Example, if a group of 100 students takes a math test and a student scores in the 85th percentile, it indicates that this student scored better than 85 others.